So what we've tried to do is split our patients into a box. And there's going to be 3 boxes. There's going to be a green, there's going to be an orange, and there's going to be a red. Now, red is cases where patients you're not going to treat. But green is what we really want you to treat. Now, that means we've got to be able to screen our patients and find out whether they fit into a green box. Now, what does green mean? Well, if we look at this in a bit more detail, it means that there's no significant muscle pain or TMD issues. There's no sleep apnea, and the occlusion or the bite, their functional movements are repeatable. So both their static and dynamic movements are repeatable. That is a predictable patient. You box them in green, move on to the next step. What if it's an orange patient? Well, an orange patient is patients that are going to have some interdisciplinary treatment required. What do we mean by interdisciplinary treatment? Do they need any ortho? Do they need any soft tissue work to improve the zenith, the shape of the soft tissue? This all needs to be assessed. What about implants? They've got missing teeth. That will also normally align with ortho, because do we need to create the right amount of space? Do we need to move the teeth into a better position? So when there's interdisciplinary treatment required, this means it takes a bit longer. We're going to move into the orange box. What if they've got some muscle pain or some TMD symptoms? And these are sort of mild to moderate, not severe, mild to moderate, and the bite is unrepeatable. So this means we need to do some pre-treatment. We need to either do some splint therapy, get some physiotherapy, and I'll talk a bit more about that over the next sort of series. We need to make sure that we make them a green patient. So if they do have muscle pain, TMD issues, and unrepeatable bite, we will manage that first to make them a green patient, and then we move through the green workflow. Now, red, simply put, is to avoid. You refer them to dentists, or to your colleagues, or to specialists who deal with a multidisciplinary team approach, because these patients need that. They need psychological support. They need chronic pain management. So they need drugs that will help with that pain. So it needs a far greater input. So red is not the patients that I'm going to be talking about. We're going to be talking about predominantly green patients and how to manage some orange patients to make them green.